So, what up, people? This is Ron again, and I'm just here to talk about my nursing school experience. So, starting nursing school, and you have to start thinking differently regarding like critical thinking and combining everything from your prerequisites like anatomy, physiology, pathophysiology, microbiology, even though even orgo. But like micro for me wasn't a good experience. I just don't think I got from that class was like microbiology, the study of microorganisms. The class was like hard for no reason. When professors have tenure, they don't care, and that was just my experience. But nursing school, I do have to say I do like how I can like use my brain differently compared to how I started nursing school and feel more comfortable being with patients. Um, Nursing school is pretty much like just changing your thinking and being more comfortable about your skills and pretty much gaining confidence in yourself too. Uh, let's see. I don't know, like my nursing school experience was kind of rough because I was dealing with a whole bunch of stuff when I started, and it just seemed like wasn't really that much sympathy or like they was willing to help you out. In my opinion, I feel like if you're from a different culture compared to how the majority of the class is, they don't understand, and I started catching on to that. Like my learning style is completely different than how you had other students, and especially regarding clinical instructors. It's not a lot of clinical instructors, at least that I had, that would take the time to help you sit down with you and help you think through, like, let's say, CSAs, clinical synthesis assignments, and like, all right, this nursing diagnosis matches with this lab value, and then also what your patient mentioned. Like, you have to carefully think about what's happening, what outcomes do you want, what goals, what objectives you want for your patient. And I don't know, I felt like it's one instructor that helped me really get past that hump and help me sit down, take a step back, and fully think about the whole picture. Because most of the instructors is like, you need to see the big picture. You're not seeing the big picture. Well, help me see it. Like, I don't know what else I can do. I mean, I'm trying everything, especially with test taking. I struggled a lot with test taking. I would go to the counseling center, end up having anxiety from nursing school, and also, I don't know, like, counseling center. I went to the Learning Resource Center, which is on my campus. It was like a test taking center, but the lady, she wasn't a nurse, and like I needed someone personally that had the experience and also had the test taking skills so I can know what to do and like work my way through it instead of being like, yep, that's the question because obviously it's this. And I'm just like, I feel like the nursing program didn't provide enough resources. I feel like you in nursing, when you, especially in going into nursing school, I feel like you need to ask or have someone sit down with you and just do a few practice questions so you know how you need to think instead of you just going into nursing school and not knowing what is going on. Because test taking was really bad for me. I ended up failing my medical surgical course because I couldn't pass the exams. Like I didn't. I mean, I got through level one nursing, which was like foundations, but that was like by the hairs of my chinny chin chin. Level two was like med surge, and it was just like combining like nursing actions and then understanding the patho and combining it together so you can know how to pretty much not kill your patient. And it just wasn't clicking, and it was so frustrating, like being one of the few students that was like struggling, especially if you're, I don't know, the only black. Me personally, I was the only black guy in the nursing program, and that caused me a lot of stress and anxiety because, like, when you see the majority of the class doing well, and you're doing literally everything in the book to try to do well, and it's still not working, it's frustrating, especially with the combination of clinicals. Like, I feel like clinical instructors, there is a intergenerational conflict because most of the instructors are like in their what 50s and 60s and like don't have that much experience dealing with students from other cultures. At least that's what, like, again, in my opinion, I just I didn't have a good experience with my nursing program. It was only a few instructors that actually took the time to like help me and sit down with me and help me think, and like that really kept me on track. The other ones was just, I don't know. I felt like I know one clinical instructor that I had. She was like up there in age, and like she was nice and all, but like when it came to me not understanding something, especially during clinical, it seemed like she got frustrated with me because I wasn't understanding. And I feel like as a teacher or professor, like you want to call yourself, you need to be able to be patient with people, and also like cater to everyone's learning styles, especially if it's maybe a cultural difference. I am a first generation college student, black, male, and like none of my family is in the medical field whatsoever, at least immediate family. Everyone that I knew, I found out that was in a nurse was like someone that was married to someone, and then oh, their cousin is a nurse, and I found this out in college. But I didn't have the resources like everyone did. Like it's a lot of people in my nursing program that had people that was in the nursing profession and they knew what to expect, and I knew I wanted to help people, but how are you supposed to do that if you're not provided the proper resources and guidance? I struggled a lot, and I just didn't want anybody else. Especially I had to fight to make a change for our nursing program because I'm like, I I don't think I think I was counting, and it's probably been less than 20 black males at least since the nursing program started. Especially when it was like 6 black students out of 75, and then one girl was Hmong, the other guy was Filipino. Now, we all would get together and talk about how our clinical instructors would say some sketchy stuff, and we're just like, are you serious? And we have to bring this up. I'm like, how can you be nurses, and especially professors, and you letting stuff slip out like that? That just pissed me off the most. I don't know, like, I just, I don't know. It did help me prepare myself, especially dealing with patients, because it was a few times I was just like, all right, how can I help you? You need some water? Let me go get that for you. And just smile because you can't say anything. But I just, I don't know, man. I feel like I felt like I needed more resources in nursing school, especially regarding test taking. Test taking was a huge weakness for me even before I started the nursing program, and I felt like I didn't know what to do. They were just like, do practice questions. I'm like, give me, do a seminar, do something for me to help me with my test taking strategies. I need strategies. It was just me hit and miss, and that's how I was learning in nursing school. I was just like, in nursing school, I was like pretty much learning. It took me closer to halfway for me to figure out like how to study and how I should go about my thinking. So like for test taking or regarding notes, I would turn all my information to charts. I would compare diseases and like how the disease in one column, and then also have like the symptoms, the nursing interventions, the tests that need to be ran. I would do all that and study that way. And then with me, I'm a visual learner, so I would use a whole bunch of colors and then especially pictures to help me better understand the material. Also, I would use I downloaded like NCLEX apps. I downloaded the RN Mentor, the NCLEX Mastery to help me like do more practice questions so I can get used to doing questions. And that's how I really did improve close to the end of my nursing program career. Clinical, I think students really struggle with is confidence in yourself and your own abilities. But I also feel like you need a good clinical instructor to help you get past that hump. You need someone that's going to nurture your skills instead of being ridiculed. Because honestly, it was 2 semesters that I was literally depressed when I had to go to my clinical. Like, she made me feel terrible about myself. Even though she didn't do it directly, I felt like she was harder on me for some reason, and I was trying my best to get through clinical and also to learn but she just did not make it a valuable experience for me. It was like 2 semesters I felt like that. I was just depressed. I was having panic attacks, anxiety, and I was just like, we had to do journals too with our clinical assignments. And I was just like, I'm unhappy. I'm like, when I feel like I'm messing up all the time, she was like, why are you so unhappy? I was just like, in my head, I was just like, you make me feel bad about myself and hate the nursing program and also hate nursing altogether. Like, I don't want to be here. And it came down to me, if I did not have a good preceptor in my last semester, which is a nurse that you're assigned to, and you care for the patients that he or she has that day, if I didn't have a good preceptor, I would have been done with nursing, to be honest. Like, as much as I want to help people, if I didn't have someone that nurtured my skills, it would have been a wrap. I just felt like I was unhappy for most of the nursing program because I felt like I wasn't getting what I needed. And it was like minimum people that understood, especially if you feel like you're being targeted sometimes, especially if you voice your opinions, because like sometimes things happen and everyone else is scared, and then you have to step up as a leader to make changes. But then once you step up and say something, I personally got targeted quite a few times, and I'm just like, I'm not want to stay quiet if it's something I think could be improved on, or I feel like students are not getting what we need. And I was never the one to be quiet. That's just not me. That's why I fought so hard when I was leaving the nursing program to make changes. I was telling them that they needed to have more services for test taking through the college and not through another department. They need to understand cultural sensitivity. That was the main one. Understand that people don't, some programs, nursing programs have outreach programs. Don't mention in front of other students that those students are a part of that outreach program. Like, we feel like we're being targeted because we're getting extra resources that we need. And I feel like that was a problem that I was having too. Also, like, regarding clinical times, we shouldn't, like, I was scheduled, I don't think nursing programs understand, like, my last semester, I had my preceptorship, which I had to match my schedule with my nurse's schedule. I was also working and also had to do my community clinical. My community clinical would meet on Mondays, and then if something happened on a Monday, instead of having us, our clinicals was on Mondays. One time it was, she had 1 week canceled for a week or something like that, and instead of, like, going to the nursing building and working on a community assessment, we had to go to an 8-hour immunization seminar for continuing education. And I had to take off work, and it was another day that I had to take off work. I'm like, first off, we should not be scheduled on non-clinical days. Second off, I need the money to pay for my rent, gas, electricity bills, sometimes stuff regarding the nursing program. Like, they don't understand that. And if it's something like that, I suggest bringing that up with the quickness. Do not be afraid to speak your mind when it's something not right. You go to a nursing coordinator. If you try the instructor first and they don't do anything, you need to go to the nursing coordinator. And if that doesn't happen, you have to go up the chain of command. Just like nursing say, go up the chain of command. You're going to have to do that to make change, because it's not right when stuff is happening and people are just scared to say something. What else? Nursing school. I don't know. Close to the end of the semester, I feel, or the end of your nursing school, you gain like a understanding your capabilities, where you need to grow at, and what area you want to work in, and also what your specific needs are to become like the best nurse as possible. Like me, I'm currently still waiting to take my NCLEX, but I'm trying to find like a good hospital that has like a nursing residency program, or at least good teachers, good nurses that provide what I need. And that's going to be really important for you, especially as a new graduate nurse. I haven't, like I said, I haven't did that yet because I'm still waiting to get hired, and it's a little bit of a struggle right now, but we'll see. Also, to all my black males, it's a struggle. More than likely, you're probably going to be the only one in the program like I was, or it might be one other one. Like, you just find someone that you can relate to and get that support. If it's like faculty, if it's a black male faculty, if you find a black male nurse, or if it's another student that was ahead of you, you try to reach out for those resources, because honestly, it's a struggle in the nursing program. It's just, I don't know, it it was rough. It was really rough. People don't expect you to be as smart or to think differently, or like you're more proficient in certain other areas, and they're just like, oh, I didn't think about it that way. Oh, you're really smart. People don't do it consciously, but or unconsciously or subconsciously, whatever the term is. But it's a struggle, and you need to find someone that can, like, or at least friends that can understand your struggle, especially if it's like only a few people, few minorities in the nursing program. Y'all need to link up, because that's going to be your support system through nursing school. It'll be your foundation. It could be people that you can like cry, complain, go off about instructors about. You need that support system in nursing school. And like I was saying, I'm one of them. Hit me up, comment, subscribe, please. And I'm going to be posting more videos about nursing and nursing school. I just graduated. Hit me up if you have any comments or questions. I've been there. I understand the struggle. You can get through it. I failed out and had to reapply and came back hard, but it was a struggle. Just let me know and I can help you as much as possible. Peace.